A new COVID-19 strain is making headlines today, and our viewers have been writing in with questions. So we have our Dr. Kohli here with us today to give us all the answers. Hey, Dr. Kohli.
Hi, guys.
Hi. So our very first question comes in from one of our viewers named Jasmine. Jasmine writes, I've heard there's a new strain of the Delta variant that's more contagious. Should we be worried, Dr. Kohli?
So I'm not quite worried yet. We've seen some genetic mutations in the strain that we think will make it a little bit more contagious, about 10 or 15% more contagious. It's actually being called the Delta Plus, like an upgrade to the Delta virus.
More leg room with that?
Yeah, exactly. It's in the UK mostly. We haven't seen a lot of cases here in the United States, but it's more where we're headed with the trajectory that we're still getting new strains, new variants, despite having so many people be vaccinated heading into the winter season.
Great.
So I really wish those variants would start to go down, but this particular one I think hopefully won't really evade the vaccines, so we'll still be able to stop it if we all go out there and get vaccinated.
Well, let's stay on the evading theme. Marcia writes in, she says that there's a place in her building where coworkers tend to gather to smoke cigarettes, and she's wondering, could that be a possible COVID hotspot? So what would you say to her?
I would say it really could be, actually, because people who smoke are higher risk of getting COVID, getting infected with COVID, because the immunity in their lungs is compromised from all the smoke they're putting in there. When they're smoking, the act of smoking is actually more likely to create those little aerosol droplets that can linger in the air for hours, even after those people are gone, up to 3 hours.
Wow.
Because you smoke, you take that smoke in, you catch those little virus droplets, and you put them back out, and then they stay suspended in the air. So, Marcia, go talk to those people about quitting smoking and stay away from where they are.
Well, here's our
That
viewer
was the
question.
cutest advice. I'm sorry.
Don't do that.
Are you laughing at
That
me?
was so great.
It
You
was
just
a
tell them
personal
to
after
stop
school
it.
special.
It was
Tell them
very
to
sweet. I
stop
loved it.
Saved by the Valentine's
We
style, right?
appreciate it. Here's a question from Dan. What's the best way to care for my 14-year-old who just tested positive for COVID? My wife and I are vaccinated. Should we quarantine as a family?
Unfortunately, yes, because the minute you have that exposure, you have to make sure that everybody in that exposure zone stays away from other people. We are going to see more of this because we have these mixed vaccination households now where the kids are not yet vaccinated. Sam, you have one. Al, when you see your kids, some of them probably you have one. You know, some are vaccinated, some are not. So it's really important to keep your guard up, wear the masks, wash your hands, even keep the pets away, you know, because
Wow,
we've seen that
about
transmission.
that.
Exactly. And then make sure that they're fully recovered, meaning they're testing negative before they go back to school.
Wow. Any news really quickly on that pill that treats COVID? Is that going to be coming out sooner than later?
Well, we're still waiting for the FDA to offer the emergency use authorization, but I'm really excited about the fact that this coming Tuesday they're meeting to talk about kids 5 through 11.
Yes, that's a big one.
Yes.
That's it.
So that is the one that I'm really excited about. That's coming closest, and then the pill will probably hopefully be a week or two after that.
All right.
Wow.
Well, thank you, Dr.
All right.
Kohli, as always, giving us all the answers. And if you guys have a question that you want answered by Dr. Kohli, write us on social media. You can also email info@dailyblastlive.com.